Hi, Ross. How are you doing tonight?
Oh man. Okay. Let me try and pick up my mic here. Okay, I've changed something. If you guys can hear me now, if you let me know, please. Otherwise, I'll reattempt to introduce us here. Okay, cool. Thanks so much. Thanks, guys. Okay, so welcome to the stream. Just for those that are going to be watching this in the replay, I will put some notes in the description box. And then we'll timestamp those. So I'll link certain points when Candice talks about specific topics, and then you'll be able to go to those points. But for live, I'm just going to sort of show you guys what we're going to run through tonight. So starting off, just going to introduce, as we've done the stream, I'll introduce Candice, and then Candice is going to go through her story, her journey with myasthenia, and then specifically I've asked her to really give a bit of detail about her pregnancy, and she says she's happy to talk about that. It's an interesting topic, and also just trying to break down some walls there coming from a guy's perspective and allowing some girls to also give their perspective, because it affects a lot more women than men. So I thought this would be a very interesting topic to go through. And then after that, as always, if there are any questions, please post them in the chat the whole time. I'll answer them when there's a good opportunity. And at the end, Candice and I might run through some questions to each other, because once again, we haven't chatted too much before this. Try to just keep it approachable, and when we do it live, then we can ask each other some questions that we would like to know as well. So let's cut back to both of us here. So I'll just give my honest introduction of Candice. I actually have never met Candice face to face. We've chatted a bit via the Myasthenia South Africa group. Candice wrote a blog, or has a blog. She posted quite a bit a number of years ago, and I read quite a bit of her stuff when I got first diagnosed. I'm quite interested in her story, specifically because of having thyroid issues as well. And then also her interest in eating quite well as well. So one of the people that I know that was at least going gluten-free and trying certain alternatives like that. So that's what interested me in Candice's particular story. And that's why I thought, when I started this, I thought, yeah, Candice would be a good one to talk to. I messaged her last week and said, would you like to come on? And she said straight away, yes, she would. So we've put this together this week, and she's happy to share her story with us tonight. So welcome, Candice, and really thank you for, I know it's a difficult time in the evenings and at the end of a long week, so thank you for joining me, and thank you for joining this myasthenia community and sharing your story.
Sure. Thank you so much for the opportunity. Yeah, it's great to know that people actually did read my blog and really did get something from it. Haven't written in a while, but I think that's because I have a 2-year-old little munchkin running around. I can hear him knocking at the door at the moment. So I think life is just a bit hectic. But yeah, still trying to follow the same principles and yeah, live as clean and as well a life as I can. So I hope tonight is informative. I hope that I'm able to answer some questions and address any issues that come up, and obviously just give people a perspective of what it's like to be a lady with myasthenia gravis, as well as going through pregnancy and the ups and downs and things like that.
Yeah, that's awesome. So really thank you for joining us, and really looking forward myself to hearing your story as well.
Okay. Yeah, so my story actually started with the thyroid when I was about 12, 13 years old. My hormone levels were just a bit crazy and things like that. Mom diligently took me to the doctor, and I was diagnosed with hypothyroidism, so an underactive thyroid. Was put on altroxin medication, and seemed to stabilize well, and never really had any other issues per se from that at that stage of my life. Was a happy, healthy teenager, played first team hockey, very active, did everything I needed to do, and did well in my matric year and got in for occupational therapy at the University of Cape Town. Everything went well there again. And then in my final year, I started to notice that things were not 100% right. And I wasn't quite sure what it was. So I probably went through my whole of my final year having myasthenia gravis, but being undiagnosed. The first thing that I noticed was that I couldn't smile like I used to. And I'm a pretty happy-go-lucky person. I couldn't smile. And so I avoided the camera. I avoided being in front of people having to smile because I had that horrible, what they describe as the MG smile or the snarl. It's like
I try
instead
to
of
see if I can. I'll try and
smile.
see if I can bring up one of those photos that you sent me, and then I'll be able to share that with
Oh,
everyone.
yeah. I have very few of them because I think it really shows you what it looks like.
Yeah.
Even now in the video chat, I can actually see the one side of my mouth is a little bit droopy and my one eye is a little bit droopy. And so I'm not 100% in remission at all, but I'm very functional. I am a qualified occupational therapist, a mom, a wife, got 2 dogs, and yeah, loving life at the moment. So what happened is eventually, after all of these symptoms had been going on for almost a year, I got 3 weeks before my final exams, and I was just really not doing well. Kept telling everybody I'm so tired, and everyone's like, "Yeah, we're tired too," which is understandable from obviously being a final year medical student, but it was just on a different level. I couldn't climb a flight of steps. I couldn't chew a sandwich and eat it within half an hour. I just couldn't swallow it down. I was strangely enough at that time being a student in the Groote neurology ward. And even there, when I chatted to the nurses, were just like, we don't know.
Yeah.
I came to one of my final exams, and I was struggling to verbalize and actually speak during my final exams. So myasthenia has this wonderful trick that it plays on us as well, as you start off talking what sounds normal, and then it goes into this little nasal kind of a smile, or not smile, but sound, and then your voice just disappears. So that started happening in one of my final exams, and was an oral practical exam. And I said to them, I don't know what's happening. Maybe I'm sick. I need a glass of water. And after the exam, the lecturers confronted me, and they said they think I have an anxiety disorder. And I said, not so sure that's what's going on, because I really, I even presented that year at the SA ACAPAP conference. I'm not afraid of talking in front of people. There's something else. But if you say it's anxiety, I'll go to the doctor. Yeah. I'll get myself sorted out. Put me on meds. I need to get through the next 3 weeks and finish my course,
Definitely.
Okay. Phoned my mom, told her I'm coming home. Things are not great. Drove from Groote back to Somerset West, which perhaps you can help me. It's probably about a 45-minute drive on a
traffic,
good
but
day.
yeah, maybe it's an hour. Yeah.
Yeah. I could hardly see. My eyelids were drooping so much. I was kind of driving, tilting my head back to actually get home. Finally got home. My mom said she could see me rounding the corner, and she knew things weren't good. Took me straight to my GP. I actually went to a different GP than my regular GP. She sat me down and she said, I don't think it's anxiety. I'm phoning the neurologist right now. Booked me into the neurologist. And a day later, he said, I think I know what you got. And I was like, oh, okay, tell me what it was. And all I could think is, please let it not be MS,
Oh
because
yeah.
we had studied MS in detail.
Yeah.
um, he said myasthenia gravis, and it kind of rang a bell in the back of my head. But I think we probably had about a 10-minute lecture at some point in my occupational therapy degree. So I really had no clue what it was. I was then booked into ICU where I did a nystagmus test. So for those of you who don't know, it's basically reboots your system and makes all your muscles feel normal, makes everything work amazingly perfect. And then as it starts wearing off, you can see the symptoms start coming back. So it would give a positive indication for myasthenia gravis. That along with some blood tests as well as a nerve conductivity test. And I was diagnosed then the end of 2007 with myasthenia
At what
gravis.
age, sorry, were you then, Candice? Just to get 23.
23.
Okay, so about 10 years, just to give everyone an indication, thyroid issues about 10 years, and then the end of university, 23, 24, diagnosed. Okay,
Yeah. I do think that stress probably did play a
yeah,
role on the onset. Um, Obviously, nobody really knows how myasthenia comes
yeah,
about. There's a lot of different
yeah,
theories.
definitely.
I did have a course of hectic antibiotics as well. I had a vitamin, not a whole lot of injections that we had to go for hepatitis B and things. So I have a lot of
Yeah,
theories about what could have caused, but the end result is I do have
yeah.
it. And there's not much you can do to just magic it away.
And just to cut in there, if I can, just do you remember sort of your career during university, like in terms of your hours and in when you were in Grooteskier, or do you remember what hours and things you had to do?
So if there are any OTs listening, I think they can testify that we do a 7-year degree in 4 years. It's so that last year you're writing reports, you writing programs, and I was a student back in the day where we didn't have things like Pinterest where you could just pick a picture.
Yeah,
You literally were hand drawing or trying to paste things together or find things out of magazines. So working until 1 or so in the
yeah,
morning often, and then still driving to Cape Town in the traffic and driving
yeah,
home. It's a full day at varsity, 8 to 5, or it's a full day on prac. And it's a lot of emotional toll that goes into occupational therapy too.
yeah,
So you're working with people that are in the government sector, hospitals that are very sick, that have been very neglected, and then have eventually come into hospital, that maybe have had a stroke but have no family
yeah.
support, or are in the psychiatric ward, but they are schizophrenic beyond. They don't even recognize anybody. So it really is a huge emotional toll that happens as well.
Yeah, so I'm just trying to get a feel
I
for
don't you.
feel for
It's just
myself.
the hectic thing to
Yeah,
say.
in terms of
Yeah.
stress, because I know for myself and the hours I did in terms of working while studying, and I worked in the evenings and things like that, I can piece together now. But back then, I thought, well, that's normal. And like you were saying, when you said you were tired, especially in society these days, everybody will say they're tired. So how do we know that you are relatively more tired than me, for example, as a normal person? So
Yeah.
it's a very difficult one, and I mean, I got yeah. Some people might just be labeled as lazy, for example, or like, yeah, we're all tired, suck it up. It's time to get on, yeah. Um, so,
Yeah.
but I think fortunate. I don't know how many myasthenia people are watching, but quite fortunate for you. Sound like you had a quick diagnosis, where a lot of people I sympathize with. It took really long. I mean, mine was weeks or months, and I
Yeah.
say that was quick, but it sounds like you had a quick
Yeah,
diagnosis.
so it was probably a year of
Yeah,
symptoms, and then, but as soon as I got to my GP, she knew what was
that's
wrong. So
amazing.
she,
Yeah,
thankfully, was aware enough of what was going on and was able, maybe she didn't know 100%,
yeah,
but she was able to make a quick enough referral to a neurologist who was able to help
yeah.
me. So that was very fortunate. It was a big blessing. Yeah, a scary time, but a big blessing.
And then since
So yeah, then after that, I flew up to Johannesburg at the end of the year. So my family stayed at home. I think my mother had a heart attack almost, me leaving and being sick and kind of not knowing what was going to happen. But I had to do my community service, and probably have a bit of an A-type personality as well. If there's something to be done, I want to do it. Like, this isn't going to stop me. I'm going to keep on doing it, which I've really had to learn to pull back now and just be more mindful and take things as they go. So flew up to Johannesburg. I did my community service at Helen Joseph. That year, they didn't want to start me on immunosuppressives or anything like that while I was finishing my degree because they weren't sure of the side effects.
Yeah.
But that year, I started immunosuppressive therapy, corticosteroid therapy, and in about June, July, I had my first crisis.
Oh, wow.
And I was admitted to hospital, and I was given IVIG. So I had a 5-day set of Polygam. That seemed to work wonders, and I thought I'd find the magical drug that was going to solve everything. But it only lasted probably about a year. The neurologist then said I was still on immunosuppressive drugs, then to change the drugs, and then to consider a thymectomy. So I underwent a thymectomy as well.
And just indication, how long after diagnosis was your thymectomy?
2 years, approximately.
Okay. Cool. Just if anyone else is wondering about that.
So then after that, sometimes with thymectomy, they say I didn't have a thymoma, so a growth on my thymus gland, but because of the immune cells that mature within your thymus that could cause myasthenia gravis, they say that if you take it out, you have a high chance of recovery or normalizing or even going into remission. I'm hoping that it definitely did something, but it definitely didn't put me into remission. I can guarantee you that. So, yeah, it's a good story to tell about the horrors of waking up from a thymectomy, but it didn't put me into remission. Some people it has, but for me that didn't happen. So again, back on immunosuppressive therapy, and then things started going downwards. My immunosuppressive drugs stopped working, so I've been on 4 or 5 different types of immunosuppressive drugs. I've had 4 different IVIGs. I've had Polygam as well as Octigam. I've had 4 courses of plasmapheresis, so that's where they recycle your blood basically and give you new healthy blood from people who've donated. And it's been a rough road. So when my heart's desire was always to be a mom, always to have the pitter-patter of little feet running around, when I felt I was going to be unable to do that, I was really quite heartsore. I really was, and had a lot of family that came and stood by me, and we considered a lot of options, whether to look at adoption, whether to see what would happen, could we even get a surrogate, what would really be able to be the best option. Put it off and had a lot of prayer, and then I went the homeopathic route. So I decided I'm not going in for any of this again until I can sort out my own body. So I went to a homeopath. I went for a blood screen to test intolerances. I discovered that I was highly, highly lactose intolerant. So I haven't had milk for a good 6 years or so at least. And then just little bit by little bit, changing my diet, working through different issues in my life, figuring out how to reduce my stress, what to do, how to talk about things. All of those things really help. And being an open, half of the things we don't preach, well, we preach it, but we don't practice it. I tell other people in my life. And then I could slowly but surely see myself. I found the healthcare. So even though I'm only technically lactose intolerant, if I eat gluten-free, basically what I want to say is I try and avoid all crap. So as much sugar as possible, as much processed food as possible, eat just as much natural food
Yeah.
as that I can, then I really feel like my body appreciates it and
Yeah.
actually goes for it with it. The homeopathic side of it was really nice because I was able to get some good supplements that also then helped me to go in the right direction.
No.
You've
I'm
got a
just
question, right?
curious in terms of time. So we just to try and give everyone. I don't want to give away ages if I'm not allowed to. Just sort of, yeah,
No, you can tell. I'm before turning 35
yeah.
at the
So
moment.
there, I
So
mean, basically, just to get an indication of you had thymectomy at about 25 years old. Let's roughly. Um, yeah, and then
25,
you
26.
had your child at 32. Okay.
Yeah,
So just to
yeah,
give everyone an
32.
indication of time,
Yeah, he's
because I think when
almost
we
2 years
tell our
old.
stories retrospectively, it's difficult for someone to understand that, changing your diet or something like that. It's not like you said, okay, cool, I'm going to the homeopath. I got some supplements for a month and I changed my diet, and then the next year I decided I was going to have a child. Yeah, yeah. So
No.
just
They also recommend that if you have a thymectomy, that you should only look at falling pregnant at least 7 years
how many?
after it.
Sorry.
They say that your body acts
Oh wow.
7,
Oh
according to
wow.
the literature. So, yeah, I think it's
Yeah,
different for everybody. Just as we are called
yeah.
snowflakes, we are different. But, yeah, something to do with your body kind of getting your hormones back into order and your immune system getting back where it needs
And
to be.
sorry if I didn't listen carefully enough, but you said post thymectomy you still had immunosuppressive, but did you have a crisis post thymectomy or not?
Yeah,
4. Oh wow,
4.
and fairly spread out or
Yeah, so I would say at least once a year I went to
okay.
hospital, if not sometimes
And
twice a year.
do you want to
So,
just, because I don't
yeah.
speak about crisis and I'm not clued up on what I don't like to speak about it because it's not something I have personal experience with. So if you want to just explain roughly to those that don't know NG or what is a crisis.
So I think different people have slightly different definitions of it. A crisis would be an exacerbation of symptoms to a point where you feel you cannot cope any longer. For me personally, I know it's when I cannot stand up off the loo, when I can't swallow my own food or my own spit, when my eyes start to go cross-eyed and I have double vision. I know it's gone way too far, and I cannot by myself get
Okay.
myself better. That I really need to be admitted to the
Yeah.
hospital to do it. For some people, I've got very good lungs, thankfully, but for some people, they would also go into breathing crisis, where they then physically, even though the stats would show that they're taking in enough air, they're not actually processing the oxygen well enough. The diaphragm is not working well enough, and so yeah, they're short of breath. They feel like they can't get it, and I think a lot of times that's where people would go into emergency wards with crisis, and people would think it's just anxiety, it's a
Yeah.
panic attack. But yeah, you really have to learn to be your own advocate and say, phone the neurologist, I know
Yeah, I
what's
think
going on.
that's the scary part, and what I've heard from my senior people saying, and obviously, as Candice is describing there, guys, if my senior patient is, having a crisis, naturally they're a little bit more agitated, a bit stressed. They're getting themselves to the emergency room saying, "You need to take care of me. I'm in a crisis." And for somebody who's working in the emergency room and is not
Yeah,
familiar with myasthenia, will say, "Okay, guys, we get this all the time. Here's a crazy person coming in saying, and they're having a panic attack."
yeah,
So it's it's a very difficult one.
definitely. And a lot of times, verbalize properly. You can't actually
Yeah,
speak properly because myasthenia gravis would affect all voluntary muscles. So you can't get the
yeah,
words out to say what you need to say. You can't even
yeah,
write it down. So you really do need to have an advocate on your side, or a support
yeah,
system. Me, I've got my husband that is able to say,
yeah,
this is it. My neurologist also has been very, very good. So I can phone him in the morning and he will phone me back within 2 hours the latest he's ever left is that evening and say, I'm booking you in, this is what's happening. So, yeah.
I think, that's so important as well, because like you might get a saline solution or an IV solution. You could have things like magnesium or something in there, and you could really put a person with myasthenia in a bad situation. And obviously them stressing, the whole thing is just getting compounded. So I think what you're saying is really important. If you know you're not, well, I'm not saying you're not stable, but if you know that you might have an issue, it is good, like you said, you have to be prepared for certain things, or you've learned to take a step back and not be bullish about everything. You sort of just treat yourself in a way, like, okay, I'm sort of feeling something coming on. If I don't take a step back now, I'm going to put myself there. So that's a bit of experience, I think, that comes with age, where when you're first deteriorating, you like, sure, I got some meds, now I'm good to go. And when that deterioration comes, or you keep pushing yourself, it's not easy.
I know that there are nice emergency cards as well that you can print out. I know Myasthenia Gravis South Africa, the website has got a downloadable version of it that you can download and print out, and it's got what a crisis would look like, your emergency numbers on what medication not to give a person in crisis. So having something like that, if you can't speak to advocate for you, also really
definitely
helps.
And I think Megan mentioned, if I'm wrong, you can correct me, that she had a tag or something for a seatbelt. So I thought that was quite good if you do.
So you can, if you are from Rare Diseases South Africa, I'm also Rare Diseases South Africa ambassador. You can order things that go on your seatbelt that also say Myasthenia Gravis. And obviously from the different companies that give out medical alert braces, to have a medical alert bracelet to say that. I'm always skeptical that the paramedic might not even know what that is, but hopefully at least they translate information to somebody.
Definitely. I think that is the scary thing, and ultimately it's not, and it's maybe not controversial, but I'm not like, only advocating for myasthenia. It's for all, like you're saying, diseases. It's not like myasthenia for me is holds a closer place in my heart. Yes, biased because that's the condition that I've experienced, but it's ultimately trying to just raise some awareness that if somebody is not doing well, or it's not just like it's anxiety or it's a panic attack, this person has a problem. So it's one thing that's at least taught me that stuff, everyone is sort of invincible until they get this. No one sort of says I was a complete nobody, and it's like everyone was doing almost fine, and then all of a sudden they're not fine. So it's not like this is coming. It sort of comes out of nowhere. So really just to realize if you're not doing well, it's worth maybe seeing your GP or seeing a doctor and saying, listen, I'm having these issues for a while now, whatever your issues might be. This needs to change, because for me it's very general, but you say you're not sleeping well since forever, or you are stressing, or you are weak, or something's going on, or your eyes are cross-eyed or something. You need to get these things at least looked at.
And I think I actually work in psychiatry now, so there are, I know a lot of the doctors within psychiatry, as always, you get good ones and bad ones, but a lot of the ones that I work with, they're very good at figuring out what is psychological and what is not. And a lot of them are very good to say, let's send you for further tests, let's do this, let's figure out what it is, and then referring on. So even if you do happen to go to a psychiatrist first, just go to somebody who's going to be able to know this is this and this isn't that. Let's see where we can go.
And I sort of lean two ways on, sort of two ways on testing, because on the one hand, a diagnosis almost freaks people out, and then I think almost puts a negative in your head and then stops you from taking ground. But if you are, I think, rational about it, the diagnosis can really help you. It sort of tells you this is wrong, now you can deal with it. So as long as you don't let it cripple you, I think a diagnosis is highly valuable. But I do see...
Yeah. I don't know.
And
Yeah. I think that when I received my diagnosis, I really felt that, I at least know what it is. You know, I can Google it, so I can teach people how to say it, I can figure out what I need to do. So you can almost move forward. Whereas if you don't know, you don't know what to do either. And that's a very different.
I think for me, it took a lot of stress, or it almost like I got a bit of slack saying, yeah, you have an issue. So, like you're saying, it's not made up, or you're not just anxious or whatever. Everyone can just at least cut you some slack, and then you can try. And for me, it almost took the pressure off my life, saying, yeah, this guy's in trouble, so we're not expecting anything from him, whether that was true or not. But it's like, yeah, he's done now, and it just allowed me. It didn't really. I mean, obviously in the beginning, everyone deals with it in a way, but for me, it didn't. I didn't mope almost for that long. It was like, this is a problem. I'm like, oh man, what am I going to do here? But it was not like everyone else is then on your case saying, you got to do this, you got to do this. It's almost like everyone's like, oh shame, and that time of oh shame sort of allows you. You realize there shouldn't be any expectation on your life, but that was a time where it's sort of like I realized there's no expectation on my life. I can, anything I do from here is a bonus. So it sort of gave me that clean slate of there's no pressure. And I thought that was really valuable for me for a diagnosis. I mean, if you do want to carry on, in terms of how then, so we started talking about crisis then, but then how, when you decided you wanted to have a child, how soon after?
Yeah, so I would say it was about a 2-year process. I got to a stage where I was doing better. I went to see a homeopath who specialized in fertility, and she helped me just to get my gut into an even better space that I could. So then went everything through again: caffeine, gluten, sugar, dairy. I basically ate meat and vegetables and fruit.
Yeah.
Which I see the end results. I really understand, but for some people they find that's just way too hectic. So did that, went on to some good meds, so vitamin B, folic acid, vitamin D's and E's, and just then really helped my body get into a place where it could then experience something like that. So once I was feeling a bit better than like that, so that took at least 6 months, went to my neurologist, and I had been put on medication from the last change of medication, because I've been through already 4. And I was on medication.
Yeah.
A lot of immunosuppressive medication you cannot afford. If anyone is considering, please your investigations prior. I went to the doctor, discussed this with him, and he said, that's fine. I was ill. So I was on suppressive drugs, no cortisone. I was on Mestinon, and then my ultra stable. There was no signs of myasthenia gravis. I was completely medically stable. Then was referred by him to a gynecologist that would specialize in high-risk pregnancies, because myasthenia gravis is considered a high-risk pregnancy. Went to the gynecologist, got all those lovely women checks going and all the rest of it. And after he had given the thumbs up, then only did we decide, okay, now is the time that we can go and see if we can actually fall pregnant. So we obviously considered the natural retrofit. And I went off, because before that we were on pregnancy prevention medication. So went off all of that, and they warned us not to expect anything within at least the first year, because of all the trauma my body had been through. You can think, I was on cortisone probably for 7 years straight, and then on and off for time before that. All the different immunosuppressive drugs, as well as all the different therapies. My body really had been through them all. So kept it quiet. Didn't really tell a lot of people that we were going. Told close family, and they really stood by, guaranteed us as well. Not guaranteed, just put it as that whatever happens, they're going to be there for us. So not a lot of pressure, even though I think I'm a wish for a grandbaby every Christmas. And then, just to really just take it easy and have that day. So just trying to dial back the anxiety. And fortunately for us, within the first, after 5 months of being off all, I can't think of what the word is, being on those drugs, being on all the homeopathic support, we fell pregnant. So, I think it was something that people thought would never happen. For me, I almost didn't believe it for the first couple of months. But, it was amazing and very scary at the same point. So, went back to the gynecologist, and he confirmed that everything was looking fine, but that we would have to have more gynecological checkups just to make sure that the fetus was developing properly and that my symptoms were also unsure. So he and my neurologist worked very closely together to make sure that everything was fine. First trimester was probably the worst out of my three. I think for a lot of ladies, first trimester is very difficult. I didn't have that much nausea, but I had like an outstanding amount of really, really tired and a different energy fatigue. So more of a just the energy fatigue is what I would describe. Energy fatigue would be my muscles feeling really weak, feeling like I can't move, and this fatigue was just feeling like I need to sleep.
Yeah.
So my little boy really getting going and getting all the energy, which is actually quite common for a first trimester. Halfway through my first trimester, I started to experience double vision, and I realized this is now going into MG fatigue. Again, consulted with my gynecologist and my neurologist, and they suggested that I should go on to steroids, and I was very resistant.
That must be tough,
I kind of felt my body was really under so much pressure, and I really, I kind of saw this pregnancy as this is the only one that's going to happen, this is the thing I need to protect. So I actually made the call and I go see my boss, and I actually reduced my work hours a lot. So just giving myself extra time to rather rest and, financially, if this is really going to be my only pregnancy, it's worth it, we felt. So actually taking extra days off, so then I only worked half day and also only a full day a week. So just having that Friday to chill and do nothing. Second trimester did go a lot better, and then from there on it started flying. My MG symptoms dropped, my energy picked up, and kind of got that mommy glow, felt invincible feeling that was going on. For generalized pregnancy, even with my homeopath, she said that she was amazed that I didn't have more issues or anything like that. But I really think it was because of the preparation that happened before then, and then the continued just hormonal support and family support and extra nutrient support that I was doing. So during that time, my diet very clean, besides the cravings for chocolate.
But it's important stuff.
There's a very good sugar-free one from... So, and then I started to see a chiropractor as well. And during my pregnancy, I saw a chiropractor once every second week, just to help decrease any pains, make sure my joints were fine, and really just help that process. They also say that if you do see a chiropractor, that your birth process is a lot easier. So the chiropractor really, really helped me. I didn't have a lot of pain. I didn't have a lot of nausea. And then my energy levels actually just really started going up. So I had a whole team of people helping, and then a whole lot of people supporting as well, from my best friend making sure that I still got out the house for a
Well,
cup of coffee or
those things
tea,
are,
to my mom videotaping every night. So all of those things really, really helped. And obviously there was just huge amounts of excitement around this as well, being the first grandbaby from my side. So yeah, my pregnancy actually went really, really well. I continued on Mestinon, and I continued on my immunosuppressive drugs during my pregnancy. And they continued to take blood levels to make sure that nothing was being given through to the placenta. So Mestinon is a safe drug to take during pregnancy because it doesn't cross the placental pathway.
and that's also
Yeah,
useful stuff to know,
pregnant.
because, like I say, I'm interested in it, but I'm interested in from quite a biased thing. I'm quite interested in the guy that I listen to and read a lot of his work is Dr. A. Pete, and he talks a lot about estrogen and progesterone. And he's just, he got me onto the thing of saying, why do women experience these remission symptoms during pregnancy? And he's saying it's the one time, or it's one of the times where your progesterone levels really go up. And he's saying in the very broadest terms, estrogen can be stressful, and it's not this woman's hormone that everyone calls it. It's actually a stress hormone where it needs to be balanced with good levels of progesterone, and that's often being seen in pregnancies. And I just kept an ear open to the number of women that have had children with myasthenia, and I'm always curious to ask, how were you during your pregnancy? And I'm not saying it's every single time, some struggle, but it's just to sort of get feedback. And once again, I'm not saying it's a proof, but it's just interesting for me, the number of people that do well or do slightly better or relatively better, let's say, during their pregnancy. So that's what also really interested me when I heard that you had a child. I was quite excited just to hear about that.
Yeah. So they say it's about a 30% chance that there'll be absolutely no change during your pregnancy. There's about 28 something chance that you'll get worse, and then the rest is given to getting better. So generally, autoimmune diseases will show a decrease in symptoms while you are pregnant, and it is because the one theory is because of the high levels of progesterone and estrogen. More progesterone actually than the estrogen, because obviously as females we produce a lot of estrogen ourselves anyway, but also the constant level that it gets to. So in the beginning, the first trimester, that's why it's normally so rocky, because there's normally high levels of HTC that's peak, and then only your estrogen, my hands are not in the camera, estrogen and progesterone come up. You Google a thing. But once those levels stabilize, that's when the remission or the reduction in symptomology would be felt. So often that's also why women would have struggles during their monthly cycles and stuff like that, because of the hormonal impact. So, and I've got a lot of ladies that say that we don't just have PMS, but we have flare PMS. So you get a whole lot of pathology during that and after.
That's why I feel like I need to host some woman on this stream or chat, because it seems unrelatable to me to try and broach these questions, because there's obviously zero personal experience. So it's like, it's one thing why, it's a fascinating thing for me, just a basic thing I'm saying, why the number of women have it over men. And then it would be interesting, we don't have, any indication or data of, which people are stabilizing in terms of which gender seems to get a recovery a bit better, or which, how did those post-operation recoveries go, who's more stable on medication. And like you say, sort of cyclical stability or instability, how does that affect everyone? And just from a guy's perspective, I think everyone thinks estrogen is only affecting women. And Toby and I were speaking last week, and he was, I thought it was quite cool. I didn't even know. He opened up about, certain issues that he has, and he knows that his estrogen levels are a bit high. And I can say for myself, I've got some water retention issues and things like that Dr. A. Pete would talk about, just, grouping lists of high estrogen symptoms, and it's interesting for me how that relates to cortisol and things like that. And I've got no medical training or even minimal biology like understanding, but I sort of thought if I can wander and at least engage in these conversations, it's something that I think other people should look into. And it's not just about you have a diagnosis, you take a medication, and you hope for a remission. It's like, yeah, even in your story particular, like you're saying, you wanted to have a kid. It's a 6 year, it's a 7 year process. It's to change your diet. It's not, yeah, and it's difficult to explain to people because say you get diagnosed and tell someone you need to take 7 years if you want to have a kid, they'll be like, yeah, listen, that's a bit of a long time. But now you wouldn't swap it for anything, I'm assuming. Yeah.
No, no,
So
not
any,
no. Sounds like you dad's going to sleep already, which is a
yeah.
bonus for me. But yeah, no, he's the biggest
We've got a
blessing ever. He
couple
really is.
questions in the chat, so before they queue up too much, I'm not sure if you know Claudia. Okay. Sorry,
Maybe.
Claudia. If you do know Candice, you can let me know. But Claudia's spoken a bit about having rheumatoid arthritis and MG, and just saying that your pregnancy story is really hitting home for her. So thank you for sharing your story, Candice. And I think it's awesome just to open up and to be relatable to people. And it's one of the things what I'm saying is obviously sitting here, I want to stir conversation. And I know I realize, like, I read some of the posts on the groups, and I just sort of, you can almost hear the pain where someone really wants to have a kid. And yeah, it's funny how even if you didn't want to have it and someone said no, you're not allowed to, how it's like, yeah, I'm sure it must be. I mean, I'm not.
And I think there's a lot of unknowns as well, because a lot of people say, no, you can't have a child. There's actually gynecologists that would say to women that I know I've chatted to there's a women in
Yeah, that's what
Myasthenia
Claudia
Gravis group
said.
actually on
She's known
Facebook.
you from the WhatsApp group, so she's
Yeah,
just so nice to hear another mommy that went through
yeah,
it. So I appreciate you talking about it.
yeah. And she said, and people have told, well, gynecologists have told ladies suffering with MG that no, they
Yeah,
cannot have a child. There's
yeah,
no way it's possible. And I think it's very detrimental. If that really is your heart's desire, it's there
yeah,
for a reason. And then we have the flip side. We have our mummies that haven't
yeah,
had successful pregnancies, our mummies that have had
yeah,
many
yeah,
miscarriages, mummies that have had losses, lots of ladies that have gone and their systems haven't
yeah,
been happy, that they've gone through IVIG and nothing
yeah,
is kept. So, yeah, it's a very painful, very
yeah,
heartbreaking route as well. So I think for me, I think that was one of the reasons I almost didn't believe I was pregnant until I actually felt my child moving in me, because I almost just couldn't
yeah.
believe that it was true. I couldn't believe that it was actually
And I
happening.
think that's like,
Yeah.
to say it's miraculous, I don't think is an understatement. It's just, yeah, for me, it's just I'm trying to bring across the picture that it's miraculous, but it's not a one day or an instant miracle.
Yeah.
Yeah, it's just trying to explain. And I think it's really for, I know
Yeah.
Toby's in the chat as well. And I know for Toby, a lot of the stuff I'm doing, I can relate to him, because I knew when I got diagnosed, I wanted to know time frames, and that's part of the reason why I really want to do these live streams and talk to my senior people, because just to give everyone an indication of time. I mean, I'm not, yeah, living it up each day, but it's still. I got in from work and set this up and said, let's go, and it's been quite a busy week at work, so I wouldn't have been able to do that 4 years ago. But it's like, just be, if you're almost like you said, and I really like that, I'm going to keep coming back to it, is to at the beginning realize I've got this diagnosis, step back, take on what you can, and then I think keep adding. And if you get to a point where you can't add something to your life, it's not unfair or something. It's like you realize you're not healthy enough to take that on. And as hard as that sounds, I think pregnancy is one of those things. It's like, unfortunately, and I'm sure you would have realized, you need to get yourself into a spot where you're healthy enough to have a kid. And your body's not going to let you
Yeah.
get pregnant if you're not healthy enough to get pregnant. And unfortunately, if you're not healthy enough to keep the baby, that's also a problem. And I'm sure yeah, everyone wants to have a kid, but I'm sure everyone wants to have a healthy kid as well. And I think that must be one of the scariest things as well. I'm sure the whole time you think, if you're not feeling well, is my child all right? So,
Yeah, and myasthenia gravis isn't a genetic thing. So, and it's not contagious by any means either. But I think in the back of your mind, you know how much medication you've been on,
yeah,
and that there is a chance, however small, that your baby will have what they call transient
yeah,
myasthenia gravis. And there have been cases that children haven't actually gotten rid of it. So that's a very,
yeah, I
very
can
scary
imagine.
thing. The more I read up on it, what I found that there was very, very few cases of transient. Um, but
Yeah. I was going to
yeah,
come to Claudia.
it's a
This is
hectic.
something, so sort of post, once you had your baby, I'll ask you something else, but she wants to know if you're allowed to have a natural birth. And did the doctor say you could breastfeed? Because she was told bluntly, no way.
Okay, so yeah, that thing was, I was booked for a C-section. My gynecologist told me that there's no ways
Yeah.
that he's risking it. However, I have heard of people that have it. A lot more people in the States seem to have natural birth, but here in South Africa, I don't know anyone that's had a natural birth.
And you're talking
They
about
say no ways,
myasthenia or
which is actually the
in general? Okay.
for myasthenia. Yeah, because
Okay.
no, for
Sure.
myasthenia specifically. What happens is that because myasthenia gravis will affect your voluntary muscles, the muscles that would
Yeah.
need to contract when you're given birth aren't actually
Okay.
voluntary muscles. You
I
can believe
can't.
it, Ross.
That's amazing.
They are on the mission of their own. It's not like you can stop
Yeah.
a pregnancy happening. Once
Yeah.
it's going, it's going. And so initial stages of labor, they say, are completely fine for myasthenia gravis. But it's when it comes to the end bit, if it's a very long and tiring labor, I think any mommy that has gone through natural labor can attest to that. By the time you get to the end, you're just completely tired. And that's when they would find that a person with myasthenia gravis wouldn't be able to, and that would become then an emergency C-section, and they would
Yeah.
have to cut in all
Yeah.
directions that you don't want to know
Yeah.
about, Ross, and either use VBAC or forceps or something like that to
Yeah.
help the baby out. So, which then also leads to the case of neonatal injuries and things like that. So, when my doctor confronted me with these options as well, he said he doesn't
Yeah.
want to take the chance. He just would
Yeah.
do C-section. So that was fine. I said to him, I don't mind what happens, but I want a healthy
Yeah.
baby in there. So nobody's going to ask you how you came out of the womb. They
Yeah.
want to see that you're there. So I think there's a lot of stigma around having a C-section sometimes. But if it's going to be better for your baby and better for you, that's
Yeah.
the way to go. So
I mean, I couldn't argue in terms of risk aversion. Yeah, I can't see how. Yeah, I wouldn't go against that in terms of having a C-section for that. Like that makes the safest sense to me
yeah,
for both you and for your child. Even if you might argue, and I'm not saying someone would, that it's better to have a natural birth. And then just to follow up,
yeah. I'm still keen on natural birth. That's all they told me, and then
yeah.
I was like, okay, well, out of my hands, that's fine. One less thing I have to
Yeah,
stress
exactly. And
about.
I think
So
a lot of
that's
the
okay.
decisions for me has been
Um,
about optimal
just
choices. So, given two choices, given the circumstances, what's the best choice for you to make? And there's always circumstances. These things are not independent. You know, like you're saying, you have to weigh up what's going on. And like you said, if that goes south, that's not going to end well for you or your baby.
definitely. After obviously a C-section is very traumatic for the mother as well. They cut through 7 different layers of tissue and muscle. So if you are having a C-section, to really, really have somebody to take care of you afterwards. It's almost like you've been in a car accident and now you're sent home
Yeah.
with a
Wow.
newborn. It's
Yeah.
nuts, so it really is. So like the first 2 weeks, my husband and I don't think we even existed. It was really mad. By the time my mom came up from Cape Town, I was so thankful. She was the biggest blessing ever. I was so thankful she was here. So yeah, C-section. We had a planned C-section for the 30th of November, and on the 28th of November, I felt something start to happen, and went to the hospital, and I said, I think my baby's coming. And they said, no, 2 days time. I said, no, I think today. Anyway, by midday that day, I had a new baby. Having what they would have determined as a emergency.
Yeah.
Although I was I had already spoken to, obviously, the gynecologist, everyone on the board. I had even contacted the anesthesiologist and gone through all of the different meds that he would use, all of the different things he prescribed, what he had a previous consultation with a specialist at the hospital. Our hospital was also equipped with a NICU ward. So our pediatrician was in the delivery ward, and then immediately after Levi was born, he was able to assess him, make the necessary tests, do the necessary things. So just one point, make that they don't give you any funny, make sure that you've got everything written down. I actually had a meeting with by that time, very OCD, and I think people don't argue with pregnant mothers either. I mean, with the nurses as well, gave them, couldn't have what I would eat. So I really did a lot of prep work before then. So, yeah. The day that I had Levi, I think it was an amazing day, but also one of the hardest days for me, because I told my husband he has to stay with Levi. It doesn't matter what happens, because I knew that there was a chance that I was going to go downhill after my C-section. I didn't tell him this, but that he had to stay with me. And so as soon as Levi was born, and I heard him cry, and they hit him on my chest, they whisked him off to NICU just to do further tests to make sure that he was fine. Husband went with him, and then I was alone, and I think that was the worst time for me, because even after they had stitched me up and things like that, my husband was trying to pop in and out and be with the baby and all the rest of it. I didn't have a cell phone or anything like that, and I was all alone, and that was really, really, really hard. So, yeah, just if you are doing that, just to have somebody also make sure they come and find the mom.
No, I think this is
not the dad.
This is really important, because Claudia Sherman, I'm reading this and you're not reading it, so it's heavy emotional reading her comments and then hearing what you're saying. But I think it's just really resonating, because she was saying the same thing. Straight after her C-section, she said everything was great, but then went downhill after that. So yeah, these are things I'm not even aware of. So that's why I say a lot of these chats I want to have, because I want to ask questions. I thought if I have questions, someone else would be curious of the same thing. And I never thought about what you're saying, a C-section being highly stressful for you. And yeah, I'm very conscious of if a myasthenia person starts panicking or has some trauma and then panics on top of that, how things can escalate or spiral very quickly. So like you're describing, if C-section is heavy stressful on your body, and that's one of the things I've learned from Ray once again, is it doesn't matter where the stress comes from. It doesn't matter if it's emotional, it doesn't matter if it's a physical trauma, it doesn't matter if it's, to an extent, gut irritation that you constantly give yourself all the time. Your body doesn't differentiate between stresses, so you're still taking on these stresses, and it just compounds. So if you put yourself into the hospital and then you're not doing well, and it just spirals. So I can imagine, and probably better that you didn't mention to your husband that it might not go well.
Yeah. I don't know if you'll agree, but yes, yeah. So my little one was in neonatal ICU for 2 days. But even when he got in, he was breathing fine on his own. He had no symptoms of myasthenia gravis. But then again, I I had the pediatric specialist there, and he even had prepped the NICU nurses on what to look
Yeah.
out for, what would need to
Yeah.
be done. So we really had a comprehensive team. So it wasn't just I had a baby and we
Yeah.
hope people
Yeah.
helped. I really went through the extra effort of finding out the information, making sure that everyone had what they
And I
needed
think
to
that
have.
just goes back to your preparation, like you said. You put in a lot of preparation, and it's yeah. I wonder. This is just me. I wonder if it wasn't almost a good thing that you didn't go in on the planned day and that you went in before, so that you didn't have time to sort of stress and say like, yeah, or lie there and say, is this going to happen or whatever. It's almost like you're gonna do something, and you almost get that push.
But
You get that push before it's 3, 2, 1 jump. It's like just push you on one. You didn't have the 2, 3 or 3, 2 whatever stress time. It's just like you're gonna do it anyway.
yeah,
But obviously, yeah, that's
I think for me personally, I was
yeah,
okay. Uh, but I think for my husband, maybe it was a good thing that he was born on
yeah,
the 28th. He had no more time to stress about
yeah,
anything. It was just
yeah.
was happening.
No, I think that, and that's just personal. I'm not
Yeah.
saying it's relatable to pregnancy or anything. But sometimes
No.
if you're going to do something and you like whether you do it today or in 2 days' time, it's like just save yourself the 2 days of stressing because you're going to be that amount of nervous anyway. You just don't need to stress more. And then after that, did you have to stay in hospital for a while?
So my neurologist and my gynecologist are at the same hospital. So he came in and checked on me pre, post, every day. Whenever he was in the wards, he checked on my baby as well. So yeah, he was very good with that. If there was a exacerbation of symptoms, he had already prepped with a medical aid that I would be able to stay in hospital and get treatment, but I was actually
Yeah,
okay. I think it's one of those oxytocin mommy hormones that just
yeah,
kick you in and you're just getting
yeah.
going for it. Was also advised not to breastfeed.
Okay,
I fought this tooth and
yeah,
nail. I think just as a health professional as well, I know the benefits of that first little bit of
yeah,
breastfeeding, and I really wanted to. So, but out of stubbornness, I think, I told them I want to breastfeed. So the plan was that my half-life of my medication is about 12 hours. So to stop my medication 12 hours before the C-section, and then I'd be able to breastfeed for maximal a
yeah.
week or so, and then I'll go back onto my medication and stop breastfeeding. So just so that Levi could get that
Okay,
initial
yeah,
colostrum boost for his. Also showed that babies that may possibly have bleeding, because obviously moms and the same
yeah,
immune system. So when a baby is born, they're with your
yeah,
immune system. And still 2 to 4 days later, your immune system out and they get
yeah,
their own. So the colostrum is really one of those great things that help them do that. So I really wanted to give him the best chance
yeah.
possible. And when I surprised went into labor,
Oh shucks.
I started expressing that he was in NICU 12 hours later after my first dose of the last dose of meds that I
Yeah,
had. And I breastfeed. And then a week came and I decided I'm not going back on my meds. So I breastfed for a month
that's
and a bit.
awesome. Wow.
And it was
Yeah,
great, but I knew that my time was
yeah,
limited. So I knew that this was going to be problematic because I wouldn't be able to breastfeed for as long as I
yeah,
wanted to. And I knew the problems with latching onto bottles and breasts and blah, blah, blah. So I actually started expressing milk from day one. So while he breastfed a little bit from me, I mostly expressed milk. And I don't know, most mummies will say you live in 3-hour increments. I really remember that and feel it desperately. And then what normally you do, Ross, is one day when you have your own baby, you watch your wife with your useless nipples. You feed off one nipple, and then 3 hours later you feed off both. So I expressed both breasts every 3 hours, which was
okay,
nuts. It was just so
Yeah.
draining. It really, really was. And then I froze milk because it is safe
Yeah.
to do that with breast milk, so that he would have a store
Wow.
once I
That's
stopped.
amazing.
So
That was
a
planned once
month or
again.
so after
Yeah.
that, I was just absolutely
I can imagine.
exhausted. Um, just because your body takes so much to
Yeah.
make breast milk, it's nuts.
Yeah.
Um, and then I stopped just for my own health concerns. And yeah, then was able to give him what he needed for as long as I could, as well then supplement then with formula. So that was my breastfeeding experience.
I'm sure Claude.
Unfortunately,
Yeah.
8 weeks after his birth, when he was 8 to 10 weeks old, I started to feel those funny feelings, and my legs were starting to get weak, even though he was a tiny baby. I could feel it was
Yeah.
hard to hold him. And I phoned up my neurologist, and he wasn't happy. Went in for a check, and he said, "That's it." And I was in hospital then. So I was hospitalized when he was about 9, 10 weeks old. For a week, I had Octigam, and nothing worked. My body system was just completely out of whack. So everything that had worked, even my immunosuppressors that had worked, weren't working
Yeah.
anymore, and my body didn't want anything. So I was in crisis. I was really, really weak, and I had no place to turn to. Nothing was working in. And that's when my neurologist pushed for biological treatment for rituximab.
Yeah.
Comes my little one. And hi, come say hello. And now I am on rituximab treatment once a year. So here's my baby boy.
Toby was
Hello.
asking
I thought
how
you were
your
sleeping.
boy is, so that's awesome. Toby, if you're still tuned in, this is the answer to your question. How's the baby?
Yeah, so he's completely healthy and happy. He's had his own spills and generalized flu and things like that, but nothing, no
Yeah.
problems, no problems. So he's just using his book that I'm
No
using as my
worries.
prop. Okay. So yeah, I think after pregnancy, I really, really struggled. I really, really didn't do well. Yeah. Yay! And then to get back onto the medication, back onto the right meds took a
Yeah.
long time. So yeah, then again, just being able to have a good support team around you is really, really essential. Whether it's family, my friend, when I was in hospital, my best friend Liesel was at my house sleeping. She really, really helped out. So yeah, I think family is really essential. I don't think you can walk this route alone if you
Yeah.
are
But
considering. So I don't know how
no,
mommies do it. I really don't. Even with
yeah,
like
but
no problem,
that's what I've
mommies
seen.
do it.
So I'm also like, man, this is tough. So that's what's one of the things that I wanted to sort of broach from my senior perspective, and this has been really interesting for me. Because there's things that obviously I haven't thought about because I haven't experienced. So it's really useful for me to hear these things. So I'm very grateful for you sharing your story, and everyone else that has tuned in, I'm sure, is getting value from that. And in the future, if anyone I think searches for myasthenia gravis and pregnancy, I really think this is for me it's been fascinating. So I think if anyone is looking for sort of information, I think your story has been a real good broad picture of how it goes. And as you spoke about preparation and things like that, I think that's that's really important. There was something particular I did want to ask. It was more, yeah. I can imagine how, because I look at my senior from being what I've turned to recently is really trying to get eating to get as many nutrients in as I can, and I can imagine, like you're saying, birth being quite stressful, and then breastfeeding after that needing even more nutrients. So yeah, I can imagine that. Yeah, that would be heavy stressful. So I can see how that period after you're saying almost doubling up on your breastfeeding could leave you in a pretty tough spot. But I think that's really awesome that you were able to
Yeah.
breastfeed, because I had never even thought of these questions of medication and being able to breastfeed and things like that. I was stuck at the, are you able to have a baby? Are you healthy enough for that? And it doesn't even end, after that.
Yeah. No, it doesn't. So on my blog, which I wrote probably
I'll link
three
it in
years
the
ago now, I've got
description
a little
for
bit of
anyone.
what I've spoken about. If anyone wants to, they're more than welcome to. Or if you even want to copy paste from there, I
Yeah.
really don't mind.
Yeah, I'll put that
Yeah.
Candice's link in the description if you do have any specific questions, or you do want to read about her blog about having a child. And then after that, in terms of like I know you did eating quite well and things like that. I can say broadly. Um, After struggling, after having a few months after that and um, not having the meds work, how were you able to sort of stabilize after that? And it's
So even though I was eating really healthy things like that, it just wasn't helping. So it really the rituximab was really the answer that really helped. Getting the biological treatment and fighting with the medical aid to get the biological treatment, but then finally getting the right medication combined with the healthy eating as well as the stress things. Here we go, my darling. Um, that's what kind of pulled me through. And then once I felt myself stabilizing again, to not then just ignore the things that I had been doing, but then to continue that lifestyle. And I think then also to realize that I'm not just doing this for me. Mama. Yes, I'm also doing
as
it
your
for
family, exactly.
this little one who's
Yeah.
next to me. So to know that I need to keep myself healthy. I need to say no to things. I need to put boundaries in place. I need to be able to stop doing things
Yeah.
if I can't do them. Not push myself because I need to do things. So a lot of people have asked when is the
Yeah.
second coming, and confidently saying that I don't think there is going to be
Yeah.
a second at all, because I want to be the best mommy that
Yeah.
I can be for Levi. I want to be that person that I can
Yeah.
run around with him, that I can pick him up when he falls. I can pull around and do all kinds of things. I can read him a full story without
Yeah.
slurring my words.
No,
So that's where I'm at. Some people are obviously, being a snowflake, have a
definitely.
completely different story, and they are able to have more than one child. And some people go into full
Yeah,
remission after
exactly.
they've had their child. So, but
Yeah.
this is my story. Yeah.
I think that's amazing, and yeah, it's really been valuable for me. It's just I could ask so many questions, so you must just sort of tell me how you feeling first of all, if you're alright, and then how you doing with Levi there, if you do need to.
I think it is close to bedtime, and he hasn't quite got
Okay.
there. Daddy is normally
Yeah.
the fun one in the house, and mommy's the bedtime person, so he's not quite there. But we can
Okay.
definitely
Sure.
do one or two questions. I just need like a
Okay.
5 minute break
I'll
quickly.
just chat to
So
everyone. I'll
I'm going to.
cut across to just the notes and give a summary, and then I'll come back to you.
So here's my husband if you want to ask him any questions.
Just gonna cut to this for 1 second. So hey guys, thanks for tuning in. If you are still in the stream, basically Candice has given an overview of her story and really explained pregnancy in some really good detail. I've got a lot of good value out of it. I'm really grateful for her sharing her story. If you are still with us in the chat, you can ask some questions. She'll be with us. Maybe we do about another 10 minutes or so. If you do have any questions regarding her story or regarding pregnancy and myasthenia in general. And if you had enjoyed this content, if you're not subscribed to my channel and you would like to hear more about myasthenia in the future, you can subscribe. I'm trying to do these streams roughly every week or two. I'm trying to host different myasthenia guests and let them tell their story. So it's not just about my story, but trying to bring information together. and this one was in particular about Candice and her child. And last week I had Toby, a young gent from the States, and Toby recently diagnosed, wants to get into professional football, and myasthenia has sort of put a pause on that. So that was a really interesting one for me as well. So yeah, if you are interested in these, you can look for my channel on YouTube. You can subscribe, and if you click the bell notification icon, it will let you know when I go live in future. If you aren't, or if I change the times up a bit, then you will know when we do go live. So yeah, anything else now? We'll just do a couple questions from the chat, and then maybe I'll ask Candice one or two questions if we have time after that. So let's cut back to that. So you still good, Candice? Okay.
I'm perfect.
Toby
Yeah.
did ask a bit about diet.
I'm trying to get the question.
Okay, yeah, you can check that. I mean,
Yeah.
Claudia has written a lot in that. Maybe not too much in terms of questions, but just really relating to your story. Toby asked quite early in the beginning, saying, what other changes did you make to your diet? So I remember you mentioned that you're lactose intolerant, and you pretty much, I know you did gluten-free, and you said you did do meat and veg. So sort of what did you change sort of period over the whole thing, and what do you sort of eat now in like a normal day for you?
I, as I said, I do try and eat just as clean as possible. What am I, Jonas, child? Are you okay?
Yeah.
He's got an adventurous nature. You'll have to come to Toby for some football lessons. I try and eat clean as possible. I normally have a protein shake, a vegan protein shake, as well as obviously gluten and dairy free, and then fruit and veg as snacks. If I do I love chocolate. The free chocolate that you can get from one of our bigger health retail stores. So I have that, but not those ones that have got all kinds of other additives in. So really just looking at what am I snacking right, avoiding very high salty foods as well. I also was fortunate enough to do a genetic test, and that really pulled up that I need to avoid salty foods. I need quite a lot of vitamin B rich medication, and also, or not medication, but food, so leafy greens and things like that. I don't know if you know about the Walls
I have
protocol.
read, so it's, I mean, those things, that's sort of inspiring for me. Someone who had multiple sclerosis, for those that don't know. I think she's pretty big on all the different colored veg, and then having portions of green veg on top of that. Yeah.
I bought her book, and I really try to implement that. She's quite strict on what she does, and she's actually still on medication, even though she's getting everything. She's working and doing a lot better. So so they also call it the autoimmune paleo diet. A lot of people, so that seems to do very well with my body. So if it's protein, it's good protein. It's as free range as possible. It's as natural as possible. And it's not the cheapest, obviously, which is very difficult, especially I think with our economic times. But where I can make those choices, obviously I am.
And I've sort of done similar. She asked what's the book name. It's called The Walls Protocol. So if I get it right, I think it's WAHL apostrophe S. So The Walls Protocol. Is it Tony or Terry Walls?
Yes.
I can't remember. Tony, Terry. Yeah. But she had multiple sclerosis, or has multiple sclerosis, and she made some. I mean, I think she was in a wheelchair, mobility aid, and she was walking and things like that. So, I mean, my inspiration came from. I'm not sure if you know the book as well, Go Natural, from Johan Jacobs. He's actually got a store in Somerset West, called Go Natural, and he also had multiple sclerosis. Also changed up his eating and things like that. And that was someone bought me that book when I was diagnosed, and I wasn't not into eating well, but it wasn't something I broached or something. And she was actually just a customer at the restaurant that I worked at, and she bought me this book. And that's, I always say, for me, the first person I say thank you to is God for the the information, and just the will to sort of look for it and get better. And then just the second person I have to give credit to is this lady that bought me the book, because that started me on my journey. I wouldn't have looked for information or whatever. It's not like I'm not even a reader, so but I managed to read a whole lot of health stories and articles and things like that since then. So it's interesting how things go.
Awesome. I think spirituality plays a big role in it as well. To have a higher power, and me also just to have my faith help me guide through those times. What next? Where am I going to go? How am I going to make it through the next day? What am I going to do if this happens? Just to know that I'm not.
And then probably a bit off.
I can't seem to see.
You can't see the questions?
Yeah.
Is it on a phone or computer?
Yeah. On the
so you
iPad.
might be able to. I'm not sure if it'll show the chat or if it has to be on a PC. There's not many. Claudia's written.
And thanks, Mum, for messaging. My mom keeps sending me messages.
I tried to get on Instagram Live and try and get it, but I can't keep it. I can't do multiple things. So if someone has messaged me as well during it asking something, I don't know why I still get the deer in the headlights. Toby did ask about steroids and double vision. I think that's personally for him, because he got given the Mestinon. I think his eye hasn't really, and for how long?
When I was initially diagnosed, I didn't have a lot of double vision. It was only really, it comes and goes. You can see here is a happy little boy. I kind of feel like prednisone, cortisone is really a good choice for my body. I really don't like it. I don't like the side effects that it gives me, and I really struggle. I have to really be in a bad place before I agree with my doctor to take it now. I also don't feel like it does amazing results for my double vision or anything like that. I feel like I swell up. My water retention goes out of the window. My bone, as well as a host of other side effects that I've had. But Mestinon for me normally. I know some people have a struggle with Mestinon, but the cortisone, I think it's a short-term fix that a lot of doctors try, but it's definitely not a long-term solution.
And I think that's what, so Toby's asked me a lot of stuff, and although I didn't take prednisone even when I was advised to, if I look back now, I stopped exams, stopped everything, stopped working, I was surviving. I mean, I probably kidded myself, thought I was doing all right, but I can look back now saying, like, I wasn't functioning in society at all. So I was quite surprised the doctors, they were on board when I said I didn't want to take prednisone, and they said, why? And I said, no, I just said side effects. They said, fair enough. So it's not for those that are looking for an alternate option. I'm not one ever advising saying don't take your medication, because you can get into a real problem. And prednisone, as much as everyone hates it, I know it can work for a lot of people. And you can see that with other illnesses as well. It's not coincidental that it's used to lower antibodies, just because it can do that effectively for a lot of people. But it is, like you're saying, it's not a long-term fix, or the problem is if you are having it for long-term, things like osteoporosis and other issues come up. And besides the other problems having immunosuppressant therapies, then you are at more risk for infections and things like that. Yeah. So.
Yeah.
Okay. Yeah. Toby's back, so he says, "Oh, thanks for those answers." Toby and Claudia, if you have anything else you want to ask, you guys have been the main features in the chat. Yeah, but thanks for sharing, guys. I appreciate everyone participating in the chat, especially Claudia, and I think she really resonated, at least with your story, Candice. And I learned, more. I thought I was going to get a different side out of this and chat more diet and things like that. So it was like, yeah, I think it was really to talk about pregnancy, like you said, maybe what is a topic on its own and not overlap that with thyroid and diet, and maybe in the future we'll have to have a separate chat. I'm really curious about the different medications because, like I said, it's one area that I didn't broach too heavily because I tried to avoid everything, and I was fortunate that I didn't have to take certain medications. But I'm not sure. Yeah, I would definitely like to chat to somebody with regard to things like IVIG and Prometheus and things like that. And yeah, I'd love to chat to you again if we do chat diet in further detail or thyroid. But I appreciate your time. I appreciate taking time out of family life on a Friday evening. So I'm sure everyone that did watch also really appreciates that. So any closing comments that you would like to leave people with?
Yeah, I think everyone's journey is different. I think that you need to also just remember the place that you're in and just come to a place where you can be mindful of what's going on in your own body. So listen to yourself, listen to your own body, ask for help when you need it, and appreciate the little moments. So often do a gratitude exercise with some of my clients, and I told them that sometimes I'm so grateful just to be able to stand and wash the dishes.
That's so weird back in. Yeah.
You don't realize what you have or you don't have. So even if it's a small accomplishment, like you said, you were completely unfunctional. Now you can start working again. It's to appreciate those moments and then to build on those, to set your goals, but also to realize that there might be limitations, and then to get as much support and ask and plan. I'm a planner, so plan.
Yeah, no, that's one thing I've gotten from this, and for me, I like to see the time scale of it. So I really appreciate that you're able to lay out, just how it's not a quick thing, and I think people trying to get back on the horse or back into life the very next month or the next year, and I almost think if you can just say, I'm going to take a step back for a year or 2 or 3. You might see longer term results. I know it's difficult, everyone, like you're saying, unique story, unique position, whether you have a family or not already. But like you're saying, maybe just take stock, and just plan it out. You can, I think, get some longer term results. I was going to call it there, but Toby's asked for a last question. What advice would you give him going through university? I know you mentioned in the beginning that you were studying when you first got your symptoms. Maybe.
Sorry. Okay.
No. I'm going to say no. I'll leave that if it's alright, Candice. I think we can call it.
Yeah, I think for myasthenia gravis, it's to specifically get whatever reasonable accommodations you can from your university. So whether it's your extra time, whether it's your decreased class load, to be able to verbalize what you need. Mine was very late in my university career, so I didn't really have a lot of time to do kind of things like that. But being an OT, obviously I've advised a lot of people on things that they can do for things like that. So being able to ask for the reasonable accommodations that you can get. So Toby, you're welcome to message me and get my stuff from Ross, and then I will guide you a little bit on what you can ask for and what they actually need to be giving you.
Yeah.
So
sorry for stretching that one, Candice. I appreciate that so much. Thanks, guys. I'm gonna call it there. So if you have enjoyed it, you can send Candice a message and just really thank her for her time. But I'm super appreciative of it. Toby says thank you so much. I'm sure everyone got some good value. So thanks guys for tuning in. I'm going to call it there. I really appreciate it.